Hello everyone, my name is Susan Reyna. I'm here today with Marge Dunne. We represent Beacon Therapeutic. It's a private social service agency located in the south side of Chicago. I'd like to welcome you today. This is a live call-in show. The number is listed on the bottom. The number is 312-738-1060. It's Hotline 21, and please feel free to call, and if you have any questions or comments, we look forward to hearing them. As I mentioned, we represent Beacon Therapeutic. We're located in the south side of Chicago. We've been around for since 1968. I'm going to put some contact information on. We have 4 different locations. We have our location in Beverly, which is 1912 West 103rd. We have our Homeless Outreach Services program, which is at 117th and Western. And we have our school programs. One of them is located on Longwood, 10650 South Longwood, and our Calumet Park campus, which houses our high school program. I'd also like to put on some information about our different programs, and I'll talk a little bit about them. We have our Therapeutic Day School, which works with children ages 3 through 21 who have severe and emotional behavioral disturbances. We also have our Little IOP program, our Big Intensive Outpatient program, our homeless services, and other programs as well. But today in particular, we're here with Marge Dunne to talk about our CHIPRA program. And perhaps, Marge, you can tell us a little bit about yourself. And the one unique piece about Marge is that she left. She came and then she left, and now she's back again. So we're particularly happy to have her here today. A little bit about Marge's background, and I'm going to read some of this just so I can get it right. Marge has a bachelor's degree in social work from the University of Iowa. She has a master's degree in counseling and guidance from Lewis University, and she has over 16 years experience in working within the social service and the educational field. Marge, can you tell us a little bit about what your background is and in terms of how that's helped you in terms of the CHIPRA program?
Okay. I have worked in a variety of social service and education fields. I've worked in grade schools, in high schools. I worked at Beacon before as a therapist when I was much younger. And after I got my master's degree, I came back to Beacon and am working in this health outreach program now.
Okay. So what does CHIPRA stand for? I know it's kind of a funny little acronym.
Okay. CHIPRA is Children's Health Initiative Program Reauthorization Act. And what that is in 2009, President Obama reauthorized the extension of this health program to reach kids that don't have medical coverage.
I think particularly for Beacon, it signified a new funding stream. It's a program that's funded through HHS, Health and Human Services, which for us, we've received HUD funding, and that was our big federal funding, and we have some other funding, at this point, but clearly it's our HHS funding that's kind of unique. So tell me a little bit about what this initiative is. How large is the program?
Okay, we have four staff that are outreach workers. And what we do is we go out into the field. We are looking for families in Illinois who don't have medical coverage. There are 250,000 families in Illinois that don't have medical coverage, either through their employer or because they're unemployed or for various reasons. And what we're trying to do is find those families that are falling through the cracks of the medical care system and help them get enrolled in the state's insurance program so that they can have regular medical care, which is going to prevent them from falling into crisis situations with their health.
And I think one thing that what was unique for our program, Beacon's program, was that we were initially really targeting homeless and at-risk individuals. Correct. And I think because Beacon has really developed 2 unique specialties, working with special ed children and families that are high risk, but also homeless families. Correct. So I think we were targeting homeless and at-risk children and youth. So tell me a little bit about what are the qualifications to be eligible for the CHIPRA program or for healthcare. I mean, I know there's a difference between CHIPRA and all kids.
Correct. So CHIPRA is the state or the federal government's program, the Children's Health Insurance Program, and each state has their own program and their own guidelines somewhat. And in Illinois, that program is called All Kids. And Illinois is unique in that it has a very expansive program. It's actually better than many other states because right now, the guidelines as far as income are quite high, that you can be earning a higher income, but for whatever reason, you don't have medical insurance, you can qualify for the state's program. At the higher income levels, you do have to pay a premium. But at the lower income levels, you don't have to pay a premium. And at lower income levels, parents are covered as well, not just children.
Oh, so parents are not just the kids are.
Correct.
You know, and I think in this climate that we're existing, everybody's talking about healthcare.
Right,
Everybody's worried
right.
about what's going to happen. So, and how complicated is it? You know, describe kind of how the process goes. So you identify someone who's interested in this. What happens?
Okay. So we get referrals sometimes from our Beacon staff, from shelters, but also from schools. Kids that are in school that don't have medical, and staff have noticed a need for it because of some outstanding problem, whether it's vision, hearing, dental issues. So they make the referral to us. We meet with the family wherever the family's comfortable. So we'll go to the school if that's where they want to meet. We've met people at libraries. We go to people's homes, shelters, wherever they are comfortable meeting, and we do an application with them. We'll walk them through the process, what documents they need. We bring our scanners with us. We bring our computers with us, so we can actually do the entire application with them right then and there, scan their documents into our computer, and then we fax it to Springfield. And because we have this relationship, it's different than going into an office, which may take a day long and you may not get the process completed because of a lack of documents. We go through the process with them, make sure all the documents that we need are included in the application, and then we're able to follow the application to make sure there's no snags in the process, as opposed to families getting denied. I actually recently worked with a family who was denied twice, and the reason they were denied was not because they didn't qualify, but because they didn't understand the process and they didn't include all the things they needed to include. So they were actually denied twice, and I worked with them, worked with Springfield, and got the application completed and approved.
That's great. And how long does this process usually take?
Okay. Standard application takes around a month, 30 to 35 days from the time that we do the application till the time they're approved. Families usually get a letter within a week saying, we've received your application, we're reviewing, and then the review process takes a month. We do, on occasion, do priority applications. If there is a medical condition, if somebody in the family is taking life-serving medication, if there's any kind of crisis situation, then we can do a priority application, and those can get approved much quicker. Recently, one of our case managers actually got one approved in a day, which is not the standard, but
Wow. Gosh, that's
because
great.
there was a teenager that had a significant medical issue that needed to be taken care of right away.
I'm actually going to
So-
put our contact information up. Actually, I apologize. This is our, I'd like to put the CHIPRA contact information up to kind of show. So if anybody is interested in accessing these services, that would be your direct, the
Correct.
site number.
Yeah.
Now, describe a little bit about what kind of families are we speaking of? What are, and I
Okay.
think I mentioned that we targeted homeless and at-risk families, but what other types of families are we working with?
Okay. So as Susan said, originally our target was homeless families, but what we found through the process was there was a whole nother very large group of teens and families that needed assistance as well. Both families that are have been impacted by the economic situation, and in fact in Chicago there's a very high level of unemployment in the trades industry, higher than the national average because of the building slowdown. So there's a lot of tradespeople in the Chicago area that are without health coverage as well because they've been out of work for a significant amount of time and they don't want to use all their savings to try and continue COBRA. Another group of people is families that are doubled up. They've lost their housing. They're living with other people. Also teens. Teens are a huge group of the population that's uninsured. And it's either because they're no longer living at home. There's actually a growing number of homeless teens in the Chicago area, and they're living in shelters, couch surfing, or going from household to household as they can, working with family members or friends. Also living on the streets and using drop-in centers for their showers and washing their clothes. So that's unfortunate, but that's another population that has a high degree of no medical coverage.
And what are the ages of eligibility for
Okay.
all kids?
In Illinois, kids are covered till they turn 19. Parents are covered as long as they have a child that's under 19 in the household, and that if they're within the income guidelines.
And then, as I understand it correctly, that at a certain point there is no cost, but depending on
Correct.
your income, there can be some nominal cost.
Correct.
And what types of benefits are covered, or what is covered by All Kids?
All Kids is very comprehensive. It covers all medical services, shots, also covers dental, vision, mental health services, specialty services, speech and hearing, occupational therapy, all those things. When a doctor agrees that it's necessary, all those things are covered. So it's very comprehensive, more comprehensive than some people's private medical insurance.
I'd like to remind everyone this is a live call-in show. Please call us with any questions or comments. The number is listed. The number is 312-738-1060. We represent Beacon Therapeutic. My name is Susan Reyna, and I'm here today with Marge Dunne, and we're talking about Beacon's CHIPRA program. Tell me a little bit about what does immigration status do, because I know that that can be one of the barriers that would prohibit families from reaching out and accessing this type of service.
Definitely. And actually, that's another population that has a high rate of uninsured is the Latino population in Chicago. And the way it works in Illinois, and again, Illinois is unique, not all states are like this, is that it is kids are covered regardless of their immigration status. So kids do not have to have documentation that they're here in a legal capacity. Kids are always covered. Parents are only covered if there is documentation, if they have either a green card or naturalization papers. But kids are covered no matter what, and they do not have to have been born in the United States. They could have been born in another country, and they're here, so we're going to help take care of them. Also, pregnant women. It does not matter with pregnant women whether whether they have any documentation papers or not. And there's no matchup. That's something I think families get concerned about, that the Department of Immigration may find out and then they're going to have negative consequences. That's not true. There is no matchup between the All Kids system and the INS. So one part is not going to hear from the other part about families. So that's not an area of concern.
In terms of the team that's delivering these services, who makes up your team? You mentioned 4 staff, I believe.
Okay. I have myself, and I actually am in the office, but I also go out into the field and meet with families and go to events and do presentations at a variety of places. We also have a case manager, full-time case manager. We have 2 peer advocates that, we try and have people from populations that are a high need. One of our peer advocates is a Spanish-speaking peer advocate, and actually we just lost a peer advocate that was from the homeless population, and she's gotten housed now and has moved out of the city, so she's no longer working for us, but we are looking for another peer advocate.
There you go.
Correct. So and then we also have an outcomes analyst that works with us to go over all our numbers and paperwork and things.
So how do you make people aware about this service? You mentioned briefly that you go out into the community. So what are some of the events, or what are some of the things that you're where you're presenting this information at?
Okay, we've gone to quite a few things across the city, and actually the suburbs too. That's another thing with our program. Our guidelines are not within the city. We go to Chicago and beyond, suburbs, and we've gone from Joliet, Kankakee, Arlington Heights, all over Chicago and the surrounding areas. So we have quite a large range. We're willing to meet with people wherever there's a need. So what was the other part of the question?
No, that's, so tell me about a renewal or re-enrollment, or how do you maintain the benefits? How does that work? Okay, so it's generally about a month, the application process.
Correct.
Then you're in the program, and then how do you renew?
Okay. Every year, families do have to recertify, and basically what that is they get sent paperwork from the state of Illinois asking them for updates as far as their income levels and their addresses, family members that are in the home, and they have to fill that out and send that back in. What we do as part of that is we send out reminders, we email them reminders any way we can to make sure that they're filling out that paperwork, and then we can assist them as well. When they are doing that paperwork, if they need assistance with that, we'll do that as well. Again, they'll need to send in some paperwork, not just the application, but supporting their income level. And that's really, really important. If families don't send that back in, parents can often get dropped off their coverage. So they'll lose their medical card if they don't send the things in. And actually, there's a new change in the law coming this July, that if families don't send in that information, their paperwork, when they are asked to be recertified, kids will also be dropped off of coverage. So that's really, really important when they get that paperwork, that they send it back in, or the whole family may end up with no medical coverage. Goodness,
that's difficult. And I know part of this project includes the emphasis on a medical home.
Correct.
And
definitely.
So can you describe a little bit about that? What does that mean, medical home?
there is a national push for, and rightly so, is for a person to have a regular health care provider. So instead of moving from provider to provider and not having any constancy, or a medical caregiver that knows their history, that they stay with one place. So they do have that history. They are going to a provider that knows any medical issues they may have, so that there's better continuity of care and a better care overall. So what the state is asking is that when people do get covered, that they pick a healthcare provider. And there's several different options. There's some PPO type programs and there's some HMO type programs. And we share that information when we meet with families as well, and when we go do presentations.
I'm going to put your contact information on again. And again, we're talking today about our CHIPRA program and how folks can be made eligible for Illinois' All Kids program. And Marge Dunne is the supervisor of the program, and her number is listed there. And we represent Beacon Therapeutic. This is a live call-in show, so please feel free to call us if you have any questions or comments. I guess one of the things is, what are some of the barriers to families accessing the CHIPRA program or accessing All Kids services?
Okay. Some of the barriers we've identified is lack of knowledge, and actually with families that have not had to access healthcare or social services before because of the economic situation, they now have to. They're really unaware of the program. We've met families, probably within 1 month. I met a plumber, an electrician, a construction worker, a steel worker, all who were new to having to access public benefits. They had no idea that they qualified for this program. And so that's part of it, is making people aware that there is coverage out there. Some of the other reasons people don't have it is maybe transiency. Their address changes from time to time, and they have trouble getting all that paperwork done and everything in and sent back. So that's one issue. Also, language barriers sometimes, and again, we do have a Spanish-speaking peer advocate to try and overcome that barrier. So I would say those are a lot of the big ones we see, is transiency, lack of transportation to get into an office. And it does take, if you do try and get medical coverage through going to an office, it may take 4-6 hours in the office. And if you have little kids with you, it's a pretty difficult process. And again, if you don't have all your paperwork with you, that's just the beginning. You'll have to come back again, and maybe a third time again. So that's definitely a barrier for families.
So, and I like actually the fact that our team is going there. It's
right,
we're reaching out to the individuals.
Yeah.
And I think the population that inadvertently we kind of came upon was, the union workers or the folks that have experienced a reduction in hours and aren't able to pay the full benefits. Can you describe perhaps an anecdote or a scenario that we've recently come across? Because I think it is more common than we'd like to think. So can you relate perhaps a particular case or a particular situation?
Yeah. I was talking to one of our coworkers earlier. There was a family that made me really sad, and I had a hard time when I went back to my car after meeting with them. It was a family where the father had always worked. There had not been an issue with needing public benefits, and he got cancer. And in the process of me helping him, he reached over and said to me at one point, "I feel like I'm better off to my family dead than alive right now." And it's because they were struggling with these bills, medical bills from cancer treatment. He had lost his insurance, was struggling to make COBRA payments. Was going through their family savings trying to make the COBRA payments and could no longer afford them. Got to that point, and then they had nothing. And they did not think they qualified for the state's program. So, through working with them, we were able to get them approved, and he was able to start his cancer treatment again because that was kind of on hold.
So he was able to get benefits, because he had children.
The entire family, because he had children that were under 19. Not only at his income level with the unemployment he was getting, not only did his children qualify, but he and his wife qualified as well. And so he was able to start getting treatment again, and also the children, they didn't have to worry about the kids going without or having to find the money that was already so tight to pay for any medical appointments for their kids.
And I think, that's what's so valuable about this program, that is in this climate where some individuals can't afford to pay their family coverage they may be working, but they can't afford the family coverage.
Correct.
This is a viable option for those individuals as well. They may be working, but they can't pay the extra coverage for their kids. So that's what's wonderful about this particular
Right.
program.
Yeah.
Now, where are we at? This was a 2-year funded program, and we're in the process of renewing.
Correct.
Where do you see some different directions this initiative may be going, our CHIPRA program may be going?
Well, I think that we are looking at expanding even further, just making, because we have a lot of our contact within Chicago, we're looking to expand even more beyond Chicago into the suburban areas. And also, we're looking at, because we know there's such a high need among teens, we're looking at doing more aggressive outreach with teens, going to some school-based health clinics, working with some youth organizations, working with some of the drop-in centers that homeless and non-homeless teens access for care and for services.
Apparently we have a caller.
Hey, thanks for taking my call.
Uh-huh.
I just want to ask, regarding some of these healthcare options for children, how long do the healthcare options last?
It's a very good question. Thank you. Marge, can you?
Okay. As I was talking about earlier, you do have to recertify every year. So when you apply for the benefits, your child is then covered for that year, unless there is some change. If a family's income goes up dramatically, significantly, the child may not be covered anymore. Otherwise, you're covered for a year, during which time, as I said, all different things are covered. And then after a year, you have to recertify, send the information back in to see whether you still qualify.
And then the coverage goes till age 18 or age 19?
Actually, till their 19th birthday.
Till their 19th birthday.
So the month that they turn 19, at the end of that month, their coverage ends.
Okay. So long as they renew every year, submit their paperwork,
And if they are still within the qualifying guidelines,
and then they can be
they
covered.
can still be covered.
And what if they're pregnant? And I think you may have mentioned this, if they're let's say 18 or 19 and pregnant.
Right. Once they're pregnant, that renews coverage. So if they've turned 19 but they're pregnant, they can still be covered because they have a child in process.
Okay.
So
That's
pregnant above 18 do qualify as well.
I'm going to put your contact information again. I really feel this is such a valuable program in terms of making sure that everybody who's eligible can access these services. And I think clearly, the long-term benefit is that it's designed to avoid those emergency room visits, and
Definitely.
it allows for well baby care and those kinds of things that can identify more chronic cases early on and then seek the regular benefits.
Definitely.
What would you, talking a little bit about Beacon at this point, what would you say are some of the unique features about Beacon and little thoughts about growth for Beacon in the future?
Beacon has grown tremendously since I started working there way back when I was working in the school program many years ago. At that point, it was a school, and its services have expanded so dramatically. Outpatient services, just having clinicians go out and meet people where they're at so that services are more available to a wider range of people. I think I was just blown away when I came back and saw the amount of services that were available for families, and I'm sure Beacon's going to continue growing and continuing to provide more and more services.
Well, we're so thrilled that you decided to come back to us. It's a good reflection on us that we can have good people come back, go forth and grow, and then come back again. I'm going to put essentially our motto and some additional contact information about Beacon and our website information. We are on Facebook. We're also on YouTube. Our motto is empowering lives and changing futures, and that is our website information, www.beacon-therapeutic.org. Marge, I thank you very much for joining us today. My name is Susan Reyna. I'm CEO of Beacon Therapeutic, and I'm here with Marge Dunne, our CHIPRA Supervisor. And we look forward to seeing everyone again next week. Thank you very much, and have a nice evening.
Thank you.